My name is Katia Monastyrskaya and I am a basic scientist working at the departments of Urology and Biomedical Research at the University of Bern in Switzerland. Our group of functional urology, works on the molecular mechanisms of lower urinary tract dysfunction. The title of our award-winning poster is Dysregulation of phospholamban and beta-3 adrenergic receptor might lead to detrusor overactivity via SERCA inhibition. We work in close collaboration with the clinic and we're carrying out a study in benign prostatic obstruction using human patients who allow us to take biopsies of their bladders after urodynamic examination. And we use these samples to conduct a transcriptome analysis of the contents of the bladder, which then allows us to link the molecular changes in the organ with the symptoms of the disease, for example, bladder overactivity or acontractile bladders. I think our work is quite important because it helps to understand the mechanisms of action of beta-3 adrenergic receptor agonists such as mirabegron. What we found is that in bladders of patients with detrusor overactivity, there is an increase of phospholamban expression and decrease of beta-3 adrenergic receptor. And also we saw that they have an increase of smooth muscle contractility. The two proteins which I mentioned are quite important because they are regulators of calcium homeostasis, which might explain why these patients develop overactivity. I'm very happy and very honored that we won this award. And although I'm here to present it, of course, the credit goes to the teams in the lab and at the clinic. And I feel it as a recognition of our efforts of many years. It's a complicated research, but I think it ultimately can bring answers to the questions we all want to seek answers for.
EAU TV is brought to you from the 34th Annual EAU Congress in Barcelona. And if you'd like to watch more things like this, then you can click on these videos here. And you can also subscribe for the very best in medicine, from psychology to urology, from gynecology to genetics.